other side of the vertebra, okay, and these groups of muscles you can actually feel, okay, but they connect to each other, okay, so there's not separation, like logisthenous and all the rest of it. They really blend in together, okay. When they work together, you know, again, you're going to get trunk extension. Just have you slouch down a little bit. Okay, so if you put your hand there, oh, that's okay. You don't have to bend down. Okay, you're going to get a little bit more extension. Okay, you're going to get a little bit lateral flexion. Okay, and what does it do? Also rotation. Okay, and you can get some rotation of the trunk. Okay, so it depends on what the body's asking it to do. They're going to turn on and off so they can provide those movements. Okay, but again, don't bother with figuring out, oh, well, where's the origin and insertion, because there's just like so many of them. Okay, know the nerve supply, know the action. Okay, thanks.
This is for the erector spinae.
We're going to find this. Well, let's think about the origin. Okay, so the origin is
The lumbar.
okay. Lumbar and also the iliac crest. So find the iliac crest. Okay, and then the lumbar area, the epinosis. Okay, so where is it going to be for the insertion? Is it going to be here underneath the inferior aspect of the last rib? Okay, what else?
On the transverse process of the lumbar.
Of the lumbar. Okay, so the origin and the insertion is on the iliac crest. Okay, so where is that muscle belly going to be? Yeah, okay, so you're going to put your hand right there. Okay, so that's where it's going to be. So this is what does it do? It flexes, lateral flexion.
Pelvic elevation.
Yeah, let's take it. Relax. Okay, there you go. Lateral flexion, okay, and elevation. Okay, so what I'd like you to do is bring this hip up, just this one. Okay, a little bit more. There you go. Wow. Okay, cool. Okay, so we know quadratus laborum is going to be doing that action, and it's going to be right here. So if you do that again, I can feel that muscle contract. Okay, so why don't you go ahead and try that? Okay. You feel it? Awesome. Okay, so that's what I want everybody to do. Okay, find the quadratus lumborum, and have that person do that. So what do you want to identify as the origin? And you guys can help them out, that's fine.
The sternal end of the clavicle.
Okay, sternal end of the clavicle. That means this, okay? And
The sternum.
the sternum, which is here, okay? Those are its origins. Okay. Before I showed you how to find the intertubercular sulcus, you just do this. You feel a little groove. Okay, so it's right about here. So it's going to be here.
This is the insertion.
Okay, the insertion. Now, this is a special muscle because it has all these fibers that are going to go into the insertion, and they do like a little torsion, a little twist. Okay, so I'm going to have you just move your arm out like that, Grace. Do you mind if I palpate your underarm?
That's fine.
Okay, so if I put my fingers right here at the underarm, this is where most of that insertion, these fibers are going to insert into the lateral portion of the intertubercular. So they sort of twist, and then they attach themselves here. Okay, that's the insertion. Okay, so if you did this, if I had Grace hold your arm like this and bring it out a little bit, okay, now try and bring it in. Bring it in. Okay, now I can really feel it contracting. Okay? I can really feel the bulk of that insertion going in there, okay? So you can certainly do that, okay? So the main muscle area is going to be up here, okay? Nerve, okay. C5, okay. What's the action going to be?
Flexion.
Okay, so it's going to do flexion of the arm, not the elbow. Okay, so you can flex. Okay. Also, what else? It's going to
Rotate the arm.
internal rotation. So that means you're going to be doing this origin. Internal rotation of the head of the humerus. Anything else? Adduction. Okay, toward the body. Okay. Now.
Origin right here.
Okay.
And then over, down. is the body, and then right sulcus, and then right here's the insertion.
Insertion of the pectoral.
Yeah.
with the
So
fiber, okay. But if I ask you to palpate the body, the main fibers of the
Okay.
muscle,
it's right there.
there you go, okay? Any lower, you're touching the breast, okay? So. Here, okay? And let's make an attachment here, okay? So it's going to go, notice how it's going across this thorax. It's going to go into the back of the thorax. And notice that it's going to have an insertion on the anterior portion of the scapula, but on a very specific area, the medial border. Okay, so it sort of wraps around and then it attaches itself to the vertebral border on the anterior portion of the scapula, okay? Very, very clear. Okay, so what's it going to do? You reach out your arm, and what happens to the scapula?
Rotates the scapula.
Okay, it can rotate the scapula, and when we talk about rotation, we're specifically talking about the glenoid cavity right here, okay? So it can rotate what? A little bit lateral, but also upward rotation, okay? And what else is it going to do to the scapula? Abduction. So notice that, oh, the vertebral column is moving away, it's abducting from the vertebral column, okay? So that it affects the scapula in those movements, okay? Now, what is the nerve supply to the scapula? I mean,
Long
Thoracic
the
nerve.
long thoracic, okay? So I need somebody who has a sweater on that I can, the right side. Okay, so lift your arm and put your hand on top of the sweater. Oh, look what happened, whoa, okay, then bring it back down, okay? So if long thoracic was not innervating this muscle, this is what they call scapular winging. So the job of serratus is to keep it nice proximity to the thorax, okay? And as it moves, just like what Kate did with reaching up, it elevated, okay, it's staying across, it's staying right on that thoracic surface, but without that innervation, it wings out. So that person has instability of the shoulder. Okay. So if I put my hand on the vertebral border, or the medial border, okay, I already know that, oh, right anterior to the scapula, you're going to find this insertion of the serratus anterior, okay? So if I just expect you to, I don't expect you to deflect the scapula, but I just expect you to find that area and say, oh, okay, its insertion is on the anterior surface of the scapula, okay? Certainly I could then just wing this thing out and find, oh yeah, that's right, you are. Okay.
Don't record that
Too late.